Hello everybody and welcome to the April 9th Tuesday version of video clips. And I'll start with a couple of announcements. Tomorrow night, April 10th, we have a conference call on seasonal allergies with master herbalist Sabrina Seitz, who's done some conference calls for us previously, very popular speaker. And she's going to talk about remedies for seasonal allergies. And of course, the best remedy is change your diet. But for people who are just beginning the process, they still may experience some symptoms this spring, and Sabrina can help. And then on April 18th, the next Ask Dr. Pam or Conversations with Dr. Pam conference call will cover inflammation, as well as an opportunity for you to ask any other questions you have to ask me too. And want to remind everybody, the Diet and Lifestyle Intervention course starts on June 5th. Dietitians get continuing education for taking this class. It's open to all types of healthcare professionals or people who intend to become healthcare professionals. And one thing I'll add to this is we are getting ready for a massive expansion here at the Wellness Forum, including building clinics and companies and that sort of thing. We're going to need lots of healthcare professionals, and only those who've been through this program will be invited to apply. So if you have aspirations to work for the Wellness Forum, this would be a good time to take the class. All right, I've chosen two topics to talk about today that I think are important, and one of them is mammograms, and the bad news about mammograms just never stops. And it is true that some women benefit. To be really specific, about 1 in 1,000 women will benefit. But estimates are that for every woman we save, we kill six. Six women lose their life due to overdiagnosis and overtreatment. Now, I'm not going to rehash all the stuff. I have pages and pages and pages of articles in the Health Briefs online library about this, and they're referenced, so I'm going to refer you there to read all about this. But I want to cover something else related to this whole issue that I haven't spent a lot of time on before. And that is the psychological harm, which we now have evidence quantifying what that is, resulting from false positive mammograms. False positives, just to be clear, are very common. By the time a woman's had 5 mammograms, the chance of a false positive is 47%. Studies have shown that the risk can be as high as 60% in some areas. A recent study shows that 3 years after a woman experiences a false positive, in other words, she's told, you might have cancer, we have to do some follow-up tests, and then told she doesn't have cancer. Women who've been through this experience 3 years later are still experiencing negative psychological reactions to having been through this process. In fact, they're much more negative than the person who wasn't given a false positive, but more negative than the women who were actually told they have cancer. So apparently it's worse to be thinking that you have cancer and find out that you don't than it is to actually find out that you have cancer. Kind of hard to imagine. Now, this study included 1,310 women who had mammograms during a 1-year period, and 464 of these women had abnormal test results. Again, high numbers here. 174 were diagnosed with breast cancer, but 272 had a false positive result. So these women were evaluated with a number of different psychosocial factors at month 1, 6, 18, and 36. And after the first 6 months, the women with false positives were just as freaked out, I don't know how else to put it, as the women who had been told that they had cancer. And this was the same 36 months or 3 years later. I always enjoy reading discussions about these types of studies on medical sites. In other words, what do my colleagues have to say about something like this? Well, very few people are talking about eliminating mammograms. I talk about it all the time. Instead, the responses are, oh my gosh, we need to work on making mammograms more accurate. Well, I don't know how the heck we could ever do that. I mean, the results are so awful and the accuracy level is so low. I don't know what we could do to change that in a meaningful way. Some people have recommended spacing the mammograms further apart. Well, I don't know how that changes the number of false positives. Maybe we spread them out over a period of time, but it doesn't address what I'm talking about. One doctor said, well, we need to use cognitive behavioral therapy to help people cope with the false positives. I mean, it's just amazing. People will entertain, in my field, almost any idea, no matter how far-fetched, other than discontinuing the use of a diagnostic test that has proven to be harmful to far more people than it could ever help. So here's the take-home point. You've heard me saying this for years. Do not get a mammogram. All right. Now here's something else not to do. Do not get a shingles vaccine. All right, so here's the story. I can almost predict what I'm going to get emails about by watching television and reading popular newspapers and magazines. And recently, I don't know if you've noticed, but there are all kinds of commercials on TV. And I don't spend that much time watching TV. So if I've seen this ad, a few dozen times, I got to imagine the average member of the general public has seen it hundreds of times. And it's an ad talking about the need for the shingles vaccine. They feature middle-aged or older people talking about how they got shingles, how it's so painful. And so companies, of course, place these ads because they know that it will drive people to ask their physicians about a vaccine or a drug. And of course, these types of advertising campaigns are almost always accompanied by physician education programs so that docs can be taught how to recommend or even coerce patients into getting a vaccine. So I've been getting a bunch of emails, is this a good idea? And a lot of people are inquiring because they're concerned about their elderly parents who are being told that they should get the vaccine. So here's the straight story. Let's start with how do you get shingles? Well, after you get the chicken pox, the virus remains dormant in certain nerves in the body, and shingles occurs when the virus becomes active again. Medical authorities claim we have no idea why this happens. Well, I think the reason is poor health and healthy people being run down, which makes you susceptible to developing all kinds of things, including shingles. Risk factors do include poor immune system, age, although the age is coming down. It used to be shingles only happened in people over 60. Another risk factor is not having had chickenpox or getting the vaccine, in which case the person develops chickenpox, not shingles. But the risk is really low, particularly for those in good health, and there are risks associated with the shingles vaccine, just as there are with all vaccines, only this discussion never happens in a doctor's office. The efficacy rate is something that we should look at. The efficacy rates for the shingles vaccine is very, very low. About 1 case of shingles is prevented for every 175 people who are vaccinated. And there are treatments that minimize the pain and speed up the recovery if you do get shingles. Now, many of the people who are getting the vaccine have had shingles. In fact, it is painful, I'll be the first to admit. And doctors capitalize on this to get patients to have the vaccine. My gosh, you don't want that to happen to you again. But the efficacy rates are even worse for people who have already had shingles. A study shows that for people over 60 who have had shingles and been vaccinated, the recurrence rate was 19 cases per 10,000. For those who were not vaccinated, the incidence was 24 cases per 10,000. Now, in absolute terms, what does this mean? It means getting the vaccine reduces your risk of having shingles, if you've already had it, by 0.0005%. You heard that right. It's hardly worth any risk, especially for a vaccine that costs $200. Nonetheless, the CDC, and I went to their website to see this, recommends the shingles vaccine for everybody 60 years of age or older, including those who have had shingles. Now, if you want more information about this topic, I actually did a Conversations with Dr. Pam conference call on shingles, and it's posted on the members portion of the wellnessfarm.com website. But the bottom line is avoid shingles. It seems like I spend a lot of time telling people what to avoid. So the take-home points for today: avoid the shingles vaccine, avoid mammography. And that's all for now. As usual, pass this on to anybody who you think might benefit from watching it, and I will be back to you on Thursday.